Hello everyone, welcome to another case. This patient presented with GI bleeding, particularly melena. CT scan with IV and oral contrast was performed to evaluate. This is a axial contrast enhanced CT of the upper abdomen. As you can see here, there's this lobulated mass lesion involving the lateral wall of the gastric antrum, and this mass lesion has the central area of hyperdensity, likely secondary to ulceration and extension of oral contrast within the mass lesion. The mass has a large lobulated endoluminal component and has a large exophytic lum- component as well. This is another image, coronal CT, showing the same mass. Right here has a lobulated large mass, has central area of low attenuation and more pronounced peripheral enhancement. This patient biopsy revealed gastrointestinal stromal tumor, or also called as GIST. These are the most common kind of mesenchymal tumors of the GI tract. They are defined by the positive immunoreactivity to CD117, a tyrosine kinase growth factor receptor. Other mesenchymal tumors are not positive or may be weakly positive for CD117. Ulceration is a very common finding seen in approximately 50% of the patients with GIST. They tend to have an exophytic growth pattern, which is also very common, as we do see in our case here as well. These tumors tend to have hemorrhage at presentation, as this particular case also presented with hemorrhage. And in terms of enhancement pattern, as we saw, they tend to predominantly enhance more peripherally than centrally. GIST tumors tend to have variable malignant potential, and variable malignant potential is determined by the overall size and histopathological finding. So if the tumor is overall greater than 10 centimeters in size and shows greater than 5 mitosis per high power field, that is considered as high risk feature. The, the GIST tumors involving the small intestine have more aggressive behavior compared to the tumor involving the stomach. The GIST tumors tend to commonly metastasize to the liver and the peritoneal cavity. Lymph nodal metastasis is rare. Let's do a question to check out the knowledge that we have acquired from this short presentation. What is the most common site for gastrointestinal stromal tumor metastasis? As we just discussed, the most common site here is liver and not lymph node disease. Another one, which of the following is not a common site of metastasis for gastrointestinal stromal tumors? Lymph node disease. Lymph node is the least common. Even the disease extension into the liver and the peritoneum is more common than lymph nodal involvement. Thank you.